Good morning. I'm Shelley Harris. This is my paper on coordinating patient-centered care. Care coordination presentation to colleagues. Hello and welcome to this presentation that focuses on the fundamental principles that nurses should be aware of when coordinating patient care. The presentation first addresses the strategies that would effectively allow collaboration between patients and their families to achieve quality care outcomes. The aspects of change management have a direct impact to patient care, and care outcomes are then discussed. The ethical consideration and coordination of care is also discussed. Finally, the presentation addresses the specific healthcare policy that has a direct impact to nursing practice and patient outcomes. Effective strategies for collaborating with patients and their families to achieve desired health outcomes. There are multiple strategies that nurses use to collaborate with patients and their families with the aim of achieving quality care outcomes. One of the strategies to effectively collaborate with patients and their families is educating them on medication use to prevent medical errors and improve care outcomes. Medication administration is a major part of healthcare delivery. When patients are in healthcare facilities, nurses see to it that medication is taken based on the physician guidelines. However, when patients are discharged, nurses have to make sure that the patient is aware of how to administer the medication. If the patient requires assistance, family members are educated on medication administration to ensure the medication is taken on time and in the right dosage. Again, nurses need to collaborate with patients and families by educating them on lifestyle changes that they should adopt to improve their care outcomes. These changes are only possible if nurses, patients, and family members work together. Another effective strategy to collaborate with patients and their families is incorporating patients' cultural values in the care process. Patients are more satisfied when nurses understand their culture and consider it during the care process. Nurses should acquire knowledge on various cultural beliefs of the patients they interact with. This allows them to develop appropriate communication skills that allow successful interaction with patients of different cultures. For instance, if a patient is religious and believes in a higher power for healing, the nurse should incorporate their religious practices in the process of the care. This can be by allowing the patient to engage in prayers even as they receive hospital treatment. Cultural competence improves relationship between the nurse and the patients and their families, which makes the patient satisfied, which improves their health outcome. Aspects of change management that directly affect elements of the patient experience, essential to the provision of high-quality, patient-centered care. Stakeholder engagement is one of the aspects of change management that impacts patient care provision. For a change to be implemented, stakeholders have to be engaged so as to ensure a smooth transition to the change when every stakeholder involved is on board. Similarly, in patient care, all the involved stakeholders should be involved. This means that interdisciplinary teams and patients' families have to work together for quality care outcomes. Another change management element that would improve patient care is communication. Healthcare professionals have to keep on communicating with each other and with the patient to enhance engagement in the care process. Additionally, training is another aspect of change management that improves patient care as it ensures patient-centered care. Patients have to be trained on their role in the process so that they can adhere to the guidelines that will improve their care outcomes. Family members also need to be trained on their responsibility in improving the health of a patient. Finally, readiness to change and its impact is another element of change management that improves patient care outcomes. When patients are positive towards the care process and adhere to all the care guidelines, care outcomes are improved. Rationale for coordinated care plans based on ethical decision making. Ethics are inseparable in nursing care and patient care. Nurses have to coordinate care with the aim of achieving quality care outcomes guided by ethics. The reason why nurses have to coordinate care based on ethical decision making is to ensure they benefit the patient. One of the guiding principles in nursing care is making sure that decisions are made with the aim of benefiting the patient and not the nurse or the healthcare facility. Another rationale for using ethics-guided decision-making and care coordination is to allow patients to practice their autonomy. Autonomy is usually the basis of informed consent in patient care. Since care coordination requires constant collaboration between the patient and the nurse must inform the patient about the care process and allow the patient to make their decision. Again, it prevents healthcare workers provide care practices that the patient is not aware of or approved. Ethical decision making and care coordination also ensures that the patient is not harmed by the care practices. Nurses' work is guided by the obligation to do no harm to patients in the process of care. Again, use of ethics in decision making aims to ensure that nurses work while respecting the preferences and the values of patients. For patients to be satisfied with the care process, they have to be involved in decision making so that they can share their values and preferences. An ethical approach to care leads to an increased moral sensitivity by nurses. Patients are human beings with moral values based on their culture. If healthcare providers make decisions without considering ethics, they are less likely to be less sensitive to the values of the patients, which strains the care relationship. Another implication of ethical approach to care is provision of quality of care. Care quality is improved when decision making is made with ethics, consideration, and collaboration of patients. Patients are more willing to collaborate when nurses incorporate ethics in care decision making. They are more satisfied, which improves care outcomes. There is an underlying assumption that ethical decision making in nursing care contributes to waste of time as the nurses have to obtain informed consent. However, this is not the case, as failure to incorporate ethics in decision making strains the nurses, which affects their quality of care. Potential impact of specific healthcare policy provisions on outcomes and patient experiences. The specific healthcare policy that has a major impact on the care outcomes and experience of the patients is Code of Ethics for Nurses. The policy outlines the guide that nurses should follow when delivering patient care to ensure they work consistently with nursing care standards and ethical obligations in the nursing profession. Through the provisions of the policy, patients would be satisfied with the care process. Satisfaction with patient outcomes as a result of the provision of the policy that emphasizes on respect of the patient, dignity, interest, and autonomy. The other potential impact of adhering to the policy provisions is protection of the confidentiality of patients' information, which improves the level of trust between the nurses and the patient. When a patient trusts the nurse with their information, patient outcomes are improved as the nurses will have all the relevant information that will allow them to make the best care decision in collaboration with the patient. The policy also impacts patient care outcomes as it emphasizes on the use of evidence-based strategies through social inquiry and research. Evidence-based approach to care improves patient experiences and care outcomes.